Thank you so much, Dr. Lemasters, Dr. Choi for inviting me, and Sages for letting us dress down today, thankfully. Really following some really easy to follow today, people to follow, some really heavy hitters in bariatric surgery. So we will get started. Do I click through? Yeah, big thing. Perfect. Thank you. All right, so we're going to be talking about using your team support to treat weight gain, and I actually think this is maybe one of the most important topics. It's a little bit underplayed, I think, when we talk about weight gain and weight regain, especially. In many cases, we've already done a bariatric surgery. And if we think about it, all of us went out last night to main event. And guess what? Our patients go to events like that too. And I think we sometimes forget that surgery is a one day in a person's life. We do it all the time, but for our patients, it's one day out of their entire life. So when we're talking about weight gain, especially regain, we really have to think about the bigger picture. Okay, thanks. I have no disclosures, by the way. So today we will talk about the scope of weight gain, which has been mentioned by some of the other speakers, our initial assessment and involving the team in that, a pathway that involves a team approach, and a couple of tools that we've actually created for our patients based on some of our experiences. So the scope, as mentioned by some of the other folks up here, is pretty huge. Conservatively, over 1 million patients are affected in the US alone. We do on average about 200,000 bariatric surgeries per year. And so at least 40% of our sleeves, again, pretty conservatively, and at least 20% of our bypass patients are experiencing weight regain. What's weight regain? This has been mentioned by absolutely every speaker up here as well. We don't have a definition that's consensus necessarily between all the different surgeons and all the different folks working on this. Some say it's 10% of excess body weight loss or body weight. Some folks say it's a BMI of over 35. It really would be helpful for us to even determine what is considered weight regain. And again, we're talking about potentially over 50% of all bariatric surgery patients. There are some statistics in the literature that do cite that number. As mentioned by others, the reasons can range from the original surgery to metabolic adaptation to lifestyle, and some things that we don't think about, but our folks also don't live in a vacuum. They go through pregnancies, they go through menopause, they age, they go through many different changes in comorbidities, medications, all of which can contribute to weight regain as well. In our initial assessment within our program, we actually start off with a 360 comprehensive look at the patient. We want to understand what their lifestyle currently entails, how are they currently eating, how are they currently moving, and we do an assessment with them that involves a pretty deep dive into all of these different topics. This is actually two of the dietitians in our program, our coordinator and myself, and we do like each other as people outside of the program. And that is actually super important, I think. When you see your partners on your team outside of just the surgeons as not only helping you address your patient's problems, but actually in some cases being more important than you as the surgeon in the room, I think that's really critical. So in this team approach, what exactly are we doing in this initial assessment? Well, obviously, we're talking about weight. That's the reason your patient is there. They want to talk about their weight regain. Again, it's really important to identify, though, whether the patient has even regained a significant amount of weight. As mentioned by Dr. Wilson, for instance, are we talking, 10%? Is this something that could be managed with medications and some non-surgical interventions? Or are we talking more than 100% of their excess body weight has been regained, which probably can't be addressed that way alone? Also really important to understand, where is your patient in terms of activity level? Are they not really moving much? Do they have some barriers to that? Do they have new comorbidities that have popped up? Even though we're talking about weight regain as an indication for all of our discussion today, what if someone has had a reemergence of diabetes or new onset diabetes, even after a bariatric surgery? Maybe that would be a better reason to intervene than necessarily just weight regain alone. We also do need to talk about medications, because especially as people age, they start to take medications that can cause weight regain. Think of even steroids, for instance, for pulmonary respiratory diseases, but there are many others as well. So really important to do a full assessment of the patient. We also need to talk about mental health. I think we all know that there's a mandatory mental health assessment at least once before bariatric surgery, but to me, that's actually a little bit bonkers that we only put people through a one-time assessment for the most part. We know that mental health is a really big component of weight management for a chronic problem that people face over their entire lifetime. It may be worthwhile to actually engage your mental health support on a more continuous basis for your patients. And actually, in our program, our mental health providers and we met on a weekly basis in order to discuss patients and figure out how we could support them. So really something to consider engaging on a much higher level than we currently do as a standard. Also important to really consider your patient's stressors. If they have family dynamic changes, if they've lost a job, if they've lost insurance in the process of their initial surgery and now are back with weight regain because they haven't actually been able to access healthcare, that may be a really huge factor to address before you talk of any kind of revisional surgery for this patient. And also social support. Again, our patients are not in a vacuum. We live in a world that is not very conducive to bariatric diets, not very conducive to people understanding bariatric surgery and the lifestyle changes that support that long term. So really assessing whether your patient even has the ability to support a new surgery or new medications or any of that is really, really critical. And then this actually might be the most important, but good experience comes from bad experience. And your patient at this point has come in again with weight regain. So talking about their prior experience is very important. Is this a band patient who's had a band that's been managed for many years? Do they have a sleeve? Do they have a bypass? Have they actually had a SADI? Have they had something else done? Where else have they received care? What kinds of interventions have been tried? Have they tried GLP-1s or Contrave or phentermine or any other anti-obesity medications? Really important to, again, use your team to get that kind of 360 understanding of your patient. And then the middle part of this is something that we do at all of our initial assessments as well, whether it's a patient with weight regain or an initial, and that's to set goals. Everybody wants to lose weight through these surgeries. That's a given. But that's typically not a big enough motivating factor for people to be able to just magically do that for the rest of their lives and to sustain it. What can work really well for people is figuring out what activities they want to do. Do people want to go skydiving? Do they want to be able to travel easily and comfortably on an airplane? Do they want to be able to stop taking medications that they currently take or get better sleep or have a better sex life, for instance, or get pregnant? Those are really enormous motivating factors for patients and things that they can engage their family, their mental health support, and your entire team in supporting that patient get there. So again, really important to actually set goals outside of weight loss with your patients to understand their motivations. And then on the team, so one of the most, I think, undervalued people on the team is actually your coordinator or whoever accomplishes the coordination of the program. This is probably going to be the patient's first line of everything, first line of communication. This is the person that they go to with questions. They go to even enroll in your program. They go to with insurance questions, which become really critical for patients, especially in the context of weight regain and reoperative potential. Your dietitians will also be your best friends. And again, in our program, we met on a weekly basis with the dietitians to review patients from the prior week and for the week ahead, which really gave me, for instance, as a surgeon, so much insight because there were people that I thought were really on track, really ready, really should have a surgery, really would benefit from that. And the dietitians would say, hold up, this person still needs some work and still really needs to understand how they're going to build this into their busy life when they're going through a transition, for instance, in their life. Same thing with mental health. Your nursing support staff, remember, not just in your clinic, but actually your nursing support staff in the hospital, your pre-op, peri-op, all of those folks are also going to be very, very critical in preparing your patients and making sure that their potential reoperations are successful. Also underplayed is physical activity. We actually partnered with our PM&R group and rehab in our hospital in order to do assessments for every single patient, even if they were 25. And guess what? Even the 25-year-olds can really benefit from understanding what kind of physical activity they can be doing at their current state. Insurance. You probably know, as everyone else in this room, that prior authorization is a really big deal for initial surgeries, but even more so for reoperations in bariatric surgery. This concept of the one surgery, within a lifetime is still a really big barrier in many insurance policies. And really getting to know what kinds of indications the patient must have in order to even qualify for a reoperation, very critical. This outlines the same kind of pathway that we put our patients through, and we're very, very clear with our patients that this is about helping them achieve their goals. One of the goals is certainly weight loss, but that is never the only goal that we encourage our patients to set. Some of the team tools that are available to you are pretty obvious, like nutritional counseling, which is mandatory. But for instance, why not consider nutrition events where you actually bring in your patients in order to learn how to cook or go on activities with your patients? So here was a picture of a biking group that we did in Iowa City. One of our support groups in the middle there was some of our patients. And then that's not our actual nutrition event, but that's an example of one. And community activities, because again, your patients do not live in a vacuum. Even if you give them the best second surgery, best bariatric surgery in the world as a second tool, if they don't have community support, if they are just intended to do the same things that they did after their first surgery, they're not very likely to succeed. We also celebrate milestones as a team. So we really encourage patients to share their stories and encourage them to, all of these stories, by the way, have nothing to do with weight. Some of them are that patients got off of diabetes medications. Some of them are that they were able to parachute comfortably out of a plane for the first time in their life. Some as simple as being able to have more energy. So just really incredible things that it takes an entire team to support. And then out of our team approach, actually, my coordinator, Tammy Lakos, and we actually started a podcast to support patients. And we cover topics ranging from pregnancy after bariatric surgery to getting your family to be on board with surgery to all kinds of things. And we've interviewed some of the folks here in this room as part of that podcast. So if you're interested, please scan the QR code, get a hold of me. We'd love to chat with you too. But even creating these kinds of things where you see a need is really critical. So I'm not a great speaker, I'm not a great anything, but I found that this to be super critical as a community support for our patients. We also created a custom GPT, which is essentially functioning as an assistant for our bariatric surgery patients called Bari Buddy. And this is also active and available as well. So if you go on, you can actually ask, a patient can ask, can I eat an avocado 3 months after a bypass? And you'll get an answer. And this is validated through ASMBS and SAGE's guidelines, through our own program materials and data supported, and has been tested with actual patients at this point. So again, I really encourage you to get creative with your team. Where you see a need, go for it. When you have a patient in front of you, remember that they are just like you. They want to be part of a community, they want to be successful, and they're one of the 1% of people eligible for bariatric surgery that are actually showing up in your office. So it's on all of our shoulders in order to respect these patients, to treat them with a lot of dignity, and to include our entire team in our approach as we do that. Thank you so much.